The stream has now started. Alrighty. Hi everyone, welcome to another Dental Shadowers virtual shadowing session. Today we have a session with Dr. Saw, and she's a general dentist. And Dr. Saw, whenever you're ready, you can take it away.
Okay, hi. Thanks so much for having me. My name is Dr. Tina Saw, and Dental Shadowers were so nice to reach out to me and ask to do a small presentation for you guys. I love pre-dental students. As you know, I was once one myself and definitely had that journey. So I definitely want to talk to you guys a little bit about me and also some just about like dentistry in general. I am a general dentist. I practice in Carlsbad, California. My practice is called Elevated Smiles. You can find me on Instagram at Dr. Tina Saw. I post some really cool cases there. I will post a lot of things about me. There's a lot of really cool facts, dental facts that I put on there too. And a lot of my patients follow me on there. Besides practicing dentistry, dentistry is very integrated in my life in every single way. I'm the founder of Light Solutions Dental, which is basically loops and lights for dentists and hygienists and dental assistants. So one of the things is when you get into dentistry, teeth can be really small. So having loops, which are essentially magnifying glasses, and having a light to be able to see and work faster and easier, that's going to be something that's really essential. So I founded Light Solutions Dental this year, and we really took off because during the pandemic, when we all got back as dental professionals, we all had to wear face shields and lots of PPE. So we were able to create a product that adapts your light to any loop or glasses. So besides being a general dentist and also the owner of Light Solutions Dental, I am founding something called Oral Genome. We test your risk for cavities and gum disease. I'm very passionate about basically about anything that has to do with prevention and knowing your risk for cavities and gum disease. There's a lot of ways that you can rebalance your saliva, and Oral Genome, it's a testing kit. It does that. So if you'd like to learn more about that, follow Oral Genome on Instagram, or you can contact me. We're doing a little, we'll be launching in a couple of weeks. As a dentist, I've been featured on CBS, AJ and Sarah, San Diego Radio. I will be on Fox 5 next year. I've been on Dental Nachos, which is a really big dental community, and I'm also a really big member of Mommy Dentists in Business. I'm a mother of 2 children, and it's a great network that I'm part of that we talk about dentistry and mommyhood. I am a member of California Dental Association, the San Diego County Dental Society, and also the American Academy of Cosmetic Dentistry. So that's just a little bit of my background. My journey to becoming a general dentist, I never thought I would go into dentistry at all. I actually took a summer job just to help sterilize and clean instruments and turn over rooms in a busy practice. It was just a way for me to make some money. And before that, I didn't go to the dentist very often. So I started when I was working there, I started also shadowing, and I was like, wow, this is like a really cool profession. It's almost like artistic in a sense. So I learned to take x-rays, take alginate impressions, and I eventually really became a full-fledged dental assistant while I was in college. So I went to school at Case Western Reserve University. I graduated with my BA in biology. And then I went to Loma Linda University School of Dentistry in Southern California. And I ended up staying in California. So what is general dentistry? General dentists are dental artists. We do restorative dentistry, fixing cavities, treating gum disease, and then we work on prevention. So a lot of my job is, yes, I can fix all these cavities and gum disease, but My job also is to educate and tell patients about how to maintain and improve their smile. So this is a case I want to show you. We'll talk about this some more. I use something called the CEREC technology. It's same day dentistry. This guy came in, you can see the before picture. He came in looking like this. 8 hours later, he came out looking like that. This case is really special to me. It was a guy who approached me and he was like, my daughter is getting married next weekend and I can't look like this. And so just in 8 hours, we were able to make crowns with our same day technology and give him that beautiful white smile to look good for his daughter's wedding. Okay, so my typical day in general dentistry begins at about 8:45 a.m. We have a team huddle. During that team huddle, we talk to everybody on our team about every single patient. Whether it might be Jane is coming in today, she's really nervous. She's bringing in her 2 kids. She has had a tooth that's been hurting her for the last couple months. Those are things we'll talk about. We'll talk about, besides patient care, insurance or pending treatment, just because we want to make sure that everyone is on the same page. The team huddle is our 15-minute powwow to talk about everything that day. At 9 a.m. to 1 p.m., I will see my first morning of patients. I usually run about 3 columns. We have 4 chairs in our office, but I usually like to run about 3 because in that 4th chair typically is for like an emergency or a quick post-op check or something that we didn't anticipate that day. So 1 column will typically be about hygiene, so it'll be cleanings and exams. The other 2 will be restorative dentistry, which is the fixing the cavities, crowns, composites, and then the other chair will be orthodontics, post-op checks, deliveries of night guards or crowns or whitening. Then at 1 to 2 p.m., I usually take my lunch and we will do lunch at that time. It could be lunch and learns with dental reps, or it could just be meetings that I have. I'll try to catch up at that time. So that's what I'll do at that time. 2 to 5:30, we'll see, just like we saw in the morning, another set of patients with the hygiene, restorative, orthodontics, post-op, deliveries, and whitening. So same thing. Okay. So stop me if you guys have any questions. I'll just continue going on. So what kind of complaints do patients present with? So they present a lot of times with tooth pain all the time. They'll come in, they'll call right away and be like, this tooth has been keeping me up at night. And I usually ask, has it been throbbing and aching for a while? Have you taken any medications to try to calm it down? What have you done? When was the last time you seen a patient? Seen a dentist? Another thing is they might say that they have a broken tooth, or that tooth broke down while they were eating. There's a lot of reasons why a tooth can break. Another complaint I will commonly get of why patients call my office is because they want to replace their ugly silver fillings. Especially now with people being concerned about amalgam and mercury, I get a lot of concerns and people wanting to replace their silver fillings. Another thing that I'll get is people will want to cosmetically change their smile. Whether it's straightening or they chipped a tooth or they just want a full set of veneers, we will discuss all that stuff. Another complaint is bleeding gums. That typically leads to getting a deep cleaning and treating it that way. And another complaint I will typically get is tooth sensitivity, whether it's hot, cold, sweet, or general sensitivity. I ask those type of questions because if someone is having a heat pain, it's actually a different diagnosis if someone had a cold pain or a sweet pain. So everything has its meaning. So what kind of procedures do general dentists perform? So for me, As a general dentist, we're actually trained to do a little of everything. But what I really tend to focus on in my practice is doing crowns, onlays, and inlays, composites, cosmetic bonding. I like to do something called BioClear, which is no preparation veneers that are done in the chair. I also do the standard ceramic veneers, and then also the dentures and partials. I work with another doctor in the practice. He's actually my husband. I'm very blessed to be able to practice with him. His favorite procedures, which are not mine, so I'm really glad they're his favorite procedures, but he does all the root canals, extractions, and implants in our practice. So as a general dental practice, we do a little of everything. My hygienist scales, and she does scaling and root planings, which essentially are deep cleanings. Most of my patients know it that way. Periodontal maintenances, and she'll do prophies, which are the regular cleanings. My assistants will assist us in all these type of procedures, but they also do night guards and whitening for me. And sometimes they will also pop in and do some ortho deliveries. We do clear aligners in our practice. So my assistants often will help me do all of that. There are some diagnostic instruments we use. So this is actually a typical setup. These are actually photos that my assistant took. My assistant's actually a pre-dental student too. In my practice, we typically take at least one pre-dental student a year. So if any of you guys are interested in shadowing or even having an internship at our office, we would love to have you. So just contact me. We are located in North San Diego. But this is something my dental assistant just took these photos. The first photo on the left is our typical suctions. We have our high suction, which is a high evacuation. It's going to take any big debris and catch that. The slow suction is the one where a patient can close on, and it's just not as aggressive. It's just a lot more gentle. Then we have the air water syringe. And then we also have now, because of COVID, we have integrated an isolation system in our practice. It's called Dry Shield. We put a mouth prop in their mouth, and it also does some extra suctioning. It's basically to reduce the amount of aerosol that's going on. But those are my 4 key suctioning and isolation tools in my practice. Isolation is extremely important when it comes to doing dentistry, because dentistry, the mouth is moist, but our dental materials really like it dry. So all 4 of those instruments are like hands down my right hand assistant on everything. Down below in that photo is some etch, which is the blue. It's how we clean the tooth. Then we have composite, which is a white filling material. I have a curing light. I have patient safety glasses, and I also have a composite gun. Up on the top right, I have bonding. I use Gluma for desensitizing. It's an extra step that I put on my patient's teeth because I don't want them to be sensitive after a filling. We have bite paper right here to adjust and check if the bite is high. We want people to feel relatively normal and their teeth meet on both sides after the procedure that is done. We have the anesthetic syringe. We have different types of anesthetics. We have the needles. Burrs are my cutting instruments. I have a mirror, explorer, a scaler, and then also cotton pliers to be able to take things. I also have a ball burnisher to help get the composite all shaped, and then a football instrument just to shape the tooth a little bit more. Okay. So I talked a little bit about CEREC and CAD/CAM technology. The first case, the first smile case I showed you was that was completely finished with that. So the new technology in general dentistry is CEREC CAD/CAM. It's come a long way. Here's a photo of me in my practice with the CEREC CAD/CAM. It is essentially just a video camera that will scan a patient's entire mouth, and we can custom design a crown for them. The CEREC also can do orthodontic scans, and we can send any file electronically, or I can print the files. I can print the crowns in my office and then custom colorize them for the patient. Another relatively good and new technology in general dentistry is a cone beam CT or CBCT. That is something where we can actually see and scan a patient's entire skull, and we can look deep into their roots and their nerves and see what types of infections or pathologies that are going on. And another new technology is a salivary analysis. It's something like I talked about earlier, it's called oral genome, and we do at-home saliva testing kit. It tests your risk for cavities and gum disease, and with that, we're able to make some customized recommendations. So all these technologies, they help us see at a deeper level that you can't see with the bare naked eye. It helps us make dentistry a lot more efficient, and it's actually really good for the patient, and more it's good for the patient to be able to, like with the CBCT, excuse me, that we can show them what's going on, and then the CEREC technology to be able to quickly make that crown without a temporary for them. And then that salivary analysis with oral genome is extremely important because we want to see what's going on below the gum line that we can't see with our naked eye. So those, I would say, are the top 3 technologies in general dentistry. Dentistry is always trying to improve. We have everything in our practice with intraoral cameras and all of this stuff here. And patients really, really appreciate that. So I'll talk a little bit about crown preps. It's something that I do every single day, and I do it with my CEREC. So I'll go through step by step with you how I go through my crown procedures. Okay, so the first thing is, what is a crown? So a crown, a lot of people will refer to it as a cap. They will say, my tooth needs to be capped, or I had an old cap. So crown and cap, those are the synonymous terms. So why do patients need a crown? A crown is needed, tell my patients, when they need to preserve or protect a damaged tooth. The process that I see in dentistry is somebody will get a cavity. If it's small, we can just put a filling on it. If that cavity is left untreated and it grows beyond the enamel, which is the outside, and goes into the dentin and gets halfway into the dentin, then I'm going to recommend doing a crown. If for some reason they don't do the crown and that cavity keeps growing bigger and bigger, then it will need a root canal and a crown because the cavity got into the nerve. And then if it goes beyond the nerve and the tooth breaks, then at that point it needs an extraction and implant. So when I recommend a crown, I always tell my patients and I encourage them to get it sooner rather than later, because we need to preserve or protect the damaged tooth. When there's decay, cavity, or damage to the tooth, and it's too large for a filling or a veneer, that's when we need to do a crown. Another reason why I do a crown is because there's a large fracture around there. Nowadays, we're seeing more silver fillings fracturing and causing lines that these big lines, and the tooth eventually gets weak and break. So we will place a crown typically around those types of teeth. Another reason why someone will need a crown is they've had a root canal done. A root canal procedure tends to make the tooth dry because it doesn't have its old blood supply there. So we place a crown to preserve the tooth. Nowadays, with the CEREC technology, the crowns out there look very, very natural. I tell my patients, you won't be able to tell that you have a crown. It just looks that good. So clinical and radiographic examples. So I talked a little bit about the silver fillings. You can see, like, look at the fracture lines that have occurred. It's already corroded away some. There is, you can see that it's leaking in this area. You can see part of the tooth structure had broke. We call this marginal leakage. And typically these cases, hands down, I would place a crown around it. This tooth right here, see this shadowing that's right there? That is a big cavity. That tooth is going to also need a crown because by the time we remove that tooth structure, we've already lost at least 70% of the tooth. And we would have to place a crown because it's not supportive of a filling. There are different types of crowns out there. I, in my practice, do all ceramic and all porcelain crowns. That's something that the CEREC technology does. The full metal crowns, they used to be done more often, but a lot of people nowadays, they don't really like that metal look. They came up with something called porcelain fused to metal, where it has that metal underbase and then there's porcelain on top. And then, like I said, there's that all ceramic. It's the most beautiful type of crown that's out there. Another type is called zirconia. I do some of zirconia crowns in my practice. I tend to send those out. Zirconia crowns, they are a lot stronger. But what the downside is, I do find them wearing the opposing tooth. And the type of patients I will do a zirconia crown with are patients who are bruxers or severe grinders. They have a tendency to break their fillings. You can see all these wear facets, their teeth are flat. Those are the people who I will do zirconia crowns because I know that if I place an all porcelain crown on them, they will fracture it because they grind so much. So what is needed for our crown preparation? A crown preparation is going to need obviously a mirror, an explorer. Explorer is something I use to touch the teeth. In dental school, we're trained to feel how the tooth structure is. So if it's soft, it's a cavity. If it's hard and when we scratch it, you can hear that scratching noise, then you know that you removed all the cavities. So that's really key for me in a setup. A periodontal probe, that's key because that's going to help me measure the pockets. I'll check to see where the fractures are. If I feel, I'll measure them in millimeters with this periodontal probe. If that periodontal probe drops in one spot, then I get concerned of very large fractures and I start questioning if that tooth has a good prognosis or not. The other thing is a spoon excavator. That's another way that I can slowly take out cavities. And then a gingival cord packer. It goes with this retraction cord. After the crown preparations, I'll go ahead and pack the cord, which is essentially a string. It can be embedded in a hemostatic agent or something to prevent bleeding from happening, but that helps expand the tissue and helps the CEREC or the camera, or if a dentist is taking an impression, help them to be able to see where your preparation ends between the tooth and the crown. I have a spatula. If I need to just to mix anything like mix temporary cement. Forceps are always handy to have so I can grab anything that I need quickly. Articulating paper to check the bite. I obviously have a handpiece. it's a high speed and a low speed. The high speed is one that goes with the burrs, and they cut the tooth. The low speed also cuts the tooth, but it just cuts it at a slower manner. It's when I really, really need to fine tune things, I will use the low speed. There's crown and bridge scissors. There's hemostats. I have 2x2s right here. Cotton rolls I use for isolation. Sometimes I will also use like a cheek retractor. It's like a drying agent to be able to push their cheek back so that I don't cut it. Anesthetic is key. And also a shade guide too is to check the color of the crown. This is just a stock photo that I put here, but sometimes we will send out the crown to the lab, for example, like the zirconia crowns, or if I need something very, very customized, I'll go ahead and send that out. If I send the crowns out, I will temporize them. I will also take an impression. We take it with a heavy body and a light body material. Those two, I'll put the light body onto the tooth and the heavy body on the tray. We have the patient bite down and then it captures an impression of their tooth. So how is the procedure completed? The patient, first thing is the patient gets done with anesthesia. We will put a topical jelly on there to lessen the pinch of the numbing agent. And then after that, let me talk a little bit about anesthetic. There's different kinds of needles there. There's the yellow needle and the blue needle. The blue needle typically is for upper teeth, and the yellow needle is a lot longer. It's for the lower teeth. When we do a lower anesthetic injection, we typically have to numb up just the way the nerves work, the tongue and the lower lip too. So we have to get way back into the ramus area to be able to numb them up. And usually it's the yellow needle that will do it. So I always think sand and sky. That's why I have that photo here. Blue for upper because sky is up there, yellow for lower. I learned this, actually, this is a tip that I learned when I was when I was in college working at a dental office. Because I remember the doctor would always like get upset that I put the wrong needle in, and then they would have to toss it. So just think sand and sky.
I'm sure we'll all remember it now.
Awesome. So how is the procedure completed? We are first going to take a preliminary impression. So I'm going to talk actually about like the standard way that it's done. In my practice, we don't take preliminary impressions, we scan everything. But most practices are actually doing this preliminary impression step. So after I numb the patient, we can't start right away because it takes, I would say like at least 10 minutes for that numbing and anesthesia to work in. So we'll take a preliminary impression, and that's just a model of their tooth. We're going to use that later on to be able to make a temporary crown for them. Then at that time, we're also going to check the shade because we want that crown to blend in very seamlessly. And that's really it for that step. So about 15 minutes in, I'll come in and I will prepare the tooth. There's a couple of things that I want when I do the procedure. The first thing is we had to remove the cavity. After I remove all the cavity, I'm going to check to make sure that it took about 1.5 millimeters off the top of the tooth. I'm also going to take 1.5 millimeters on the side. And also all these edges have to be rounded. There can't be any bumps or anything because the crown has to adapt really, really well. So after that, I'm going to pack a cord for gingival retraction. That essentially means that there is going to be a gap that between the tooth and the gums, and it's going to help stop the bleeding that occurs from the preparation. And when we take an impression, typically that cord will come out with the impression. And then once I pull it out, you'll see the defined margin or defined ending of the preparation. So this is what the preparation looks like. My assistant will inject the blue stuff. I will inject the purple stuff. And then you can see this impression's good because there's no bubbles, no voids. We can clearly see where the tooth preparation was done. After that, I have to make sure the cord is gone. Sometimes it does hang into the mouth, but we definitely want to make sure it's gone. And then my assistant's going to take the first impression that we took before the preparation, and she's going to put this material in, seat it back in the tooth, and then make a temporary crown. So we mix these two agents, we dry the whole tooth, and then we seat the temporary crown. Then we typically, most practices will have the patient come back in 2 weeks. But in my practice, we will scan it. Instead of doing all these impressions and temporaries, we're going to just scan the teeth and actually glaze and mill and make the crown in my office. Yeah, so how's the procedure completed? We're going to fill the lab slip afterwards. We'll call for a pickup. And that's really it. Okay. So, does anyone have any questions?
We were going to wait until the end of the presentation for questions, if that's okay.
Yeah, that's absolutely fine. Okay. So making dentistry easy, this is kind of part of my repertoire. I always wear loops and lights. This is actually my son. He was trying on loops and he was like, why is it so big? He was like all weirded out about it.
He looks like a natural.
But anyways, it's ironic because he knows I'm a dentist, but he does not like to go to the dentist, and it's a struggle for us to bring him. But yeah, so anyway, so this is magnifying glasses. Like I said, I am my husband and I, we do something called Light Solutions Dental, but these magnifying glasses, we have a light, it helps us see very, very clearly, like your tooth is just really, really blown up. So all those, with these loops and magnifying glasses, I'm able to see the margins much, much closer, like this type of view. So they are my very important things that I have in my operatories. Okay. Moving forward, I wanted to talk to you guys about, give you guys some like little advice for future dentists. I get the question a lot from pre-dental students, like, well, what did you do? What classes should I take? What should I major in? Should I be doing this or that? I would have to say there's no one path to dentistry. Every resume is unique. Every journey is unique. Make it yours. So for me, in college, I worked at a dental office. I also did periodontal research, gum tissue research at Case Western Reserve University. But there's no path. There's no one path. I've seen people who were, they were business majors, they were music majors. Some of my classmates had previous careers, like two of my classmates, they used to be pilots and they wanted to just do it. I had someone else, she was a pastor's wife, and she was like, you know what, I just want to be in dentistry. There's lots and lots of ways and lots of routes. But one thing I would say dental schools are looking for is making sure that you get some hands-on experience. That's definitely going to make your resume stand out. So I would not be where I am today because of the job that I got this really amazing opportunity. Yes, it was a summer job initially when I was in college, but to have that mentorship and also to be taken on as the undergrad at Case Western School of Dental Medicine to do some research, they really helped me in my journey. But like I said, there's no right or wrong way. You just gotta just be you. Yeah. Anyways, I know actually I breezed through this a lot quicker than I thought. So there's going to be plenty of times for questions and answers. But I guess I'll just open the floor to questions.
Yes, thank you so much, Dr. Saw, for that informative presentation. I've never been able to observe a crown procedure before because of the pandemic, so that was really nice to see the process. And yeah, we'll have Alexis take our questions from the chat.
Alrighty. So the first one is what makes a good dental assistant applicant?
A good dental assistant applicant. So all of my dental assistants is like that. I first thing is I check for it personality. Because dental assisting, you've got to be really good with patient care and bedside manner. So the first thing is I check for that. And the second thing that I do is I want to make sure that they go and get their x-ray certification, their BLS or CPR, and then also the coronal polish. That's the way to get in and to get actually hands-on experience. Otherwise, you're just assisting with just sterilization, and that can get kind of boring because I know you guys want to go in and get your feet wet and actually do things.
How do you recommend that people go about getting those certifications? Is there training programs online, in person? What do you recommend?
Yeah, so there are training programs, at least I know in my area, San Diego, and I'm sure it's like this across the country. There are lots and lots of training programs out there, even during this time when a lot of places are closed for COVID. There is a huge need, I would say, right now for dental assistants. So I would really highly encourage anybody to just start looking for a place to get those credentials and then start applying to different positions.
Do you know what the cost range should be? Because as pre-dental students, we don't want to pay more than we.
Yeah. So cost range, I think my assistants were telling me it was like $250 to get polishing. Like I know they didn't pay more than $500 to get everything. But like for me in my office, we really find the right person, like the right motivated students. And I'm sure there are some dentists out there wherever you guys are located. And we've done it where I said, show me what you got. I'll, stay with me for some time and I'll pay half of your certifications for you. Mm-hmm. Oh, another thing to check, actually, now I think about it, is that some of the local dental societies, they will offer some of these classes at a reduced cost.
Okay, good to know. Once you started practicing, how did you decide which procedures that you would perform? Was it mostly preference or was it more of a financial decision?
Yeah, it's actually preference. You find out what you're really good at and what you really enjoy. So there's a lot of specialties that are out there. There's endodontics for root canals. There's oral surgery for extractions and implants. There's orthodontics. And then there's periodontics, which is specializing in gum tissue. For me, I like to do a little of everything. So that's why I chose general dentistry. And then from there, I found out I was really good at cosmetic dentistry. So I started taking a lot more classes in CE and started really mastering those type of skills. So it's really just a personal preference. For example, my husband, I met him in dental school, and he, for some reason, loves extractions. Like he is okay, he has the strength and he's okay with just digging that tooth out and then placing an implant and some grafting. So it really is like, it's just what it's like just what you prefer. Everybody has what they like different. Yeah.
Looking back on your dental school experience, how did you balance your heavy course load?
My heavy course load. Well, you kind of just had to make it work. I would say going to dental school, when you want to go, most dental students that get in, they filter through people who they know are passionate about dentistry. And so balancing my course load was like, okay, I'm going to, I was like, I'm going to focus from 8 a.m. I'm going to go to school from 8 a.m. to about 5 p.m. And then I'll eat dinner 5 to 6. And then from 7 to about 10 p.m. I'm going to study. And then 10 till 11, I'm going to de-stress by watching a show or something like that. You have to set a schedule for yourself. And at the same time, you have to give yourself breaks. I was never the person who was going to pull an all-nighter because I would rather concentrate and focus on my studying for a couple of hours because I felt like it was more effective than just dragging it on and not really taking in that information. So I was not going to fall into that trap of hours, but really just focused hours instead, and being efficient with my time.
Yeah, same here. Are there any flags that you would think maybe tip someone off that dentistry just isn't for them?
Yeah, so that's why I really encourage people to get into an office right now and get hands-on experience, really getting the polish or at least their x-ray certification in. That's the bare minimum x-ray certification, because there are definitely, I've had some new assistants or new shadows in my office who are like, oh, I definitely want to do this. And then we get in and then they see blood and then it wasn't what they thought it would be. So yes, you have to the more hours and the more procedures that you see, then you really fine tune, this is really what I want to do. Because it is not an easy journey to go through dental school, but it is totally worth it if you really, really love it.
We've had guests on where they'll say that as a general dentist, they have problems with their necks or with their backs after decades of practicing. Do you have problems with your ears hearing? Because I know the burr spins at a very high frequency.
That's actually a really good question because people don't think about that. So that's actually a new technology out there that we've brought into our practice for its electric handpieces, because typically, so when I was in dental school, it was more air driven and you would hear that high pitched whistle. And at the end of the day, your ears would kind of ring a little bit. So I work in my practice, we do electric handpieces. It's very quiet. You can't hear the preparation that's going on. Mm-hmm.
Yeah, I was just curious about that because we're on the topic of studying, and I looked up earplugs for studying, and I noticed that they had earplugs specifically for dentists. I thought that was pretty cool.
Yeah. I mean, dentistry, yes, there are ways it can be challenging physically, and it can be challenging on your ears too. It's weird, but there are new technologies out there to combat that. But it doesn't mean I don't get massages. I do, because sometimes I get a little bit stress on between my shoulder blades from just looking over. But it's if you have the right technology and you have the right posture, it shouldn't be really an issue.
Okay, someone in the chat is asking, is there any way we can get involved in oral genome analysis?
Yeah, absolutely. So, well, this is the first time I'm actually announcing this on publicly. So we are about 2 weeks from launch, and we are running we're running a soft launch, and I will put my email address. You guys can just email me at info@oralgenome.com. If you email me, you can be part of the soft launch. It's very, very exclusive, but I would love to open it up to you. You guys will actually be able, we are just running a special, it's $65. You'll be able to test your risk for cavities and gum disease. And then you'll get like an analysis of 7 different factors in your saliva and that how that affects what are the things that you can change. And some of these changes are so easy. It could be as easy as a dietary change, like little foods that you need to integrate, or certain brushing techniques, or just like the way your lifestyle is. We can rebalance your saliva. So to get involved, email me at info@oralgenome.com. I can get you like an exclusive invitation to be able to take this test pretty much just at our cost, so that you guys can kind of get on it early. Yes, and I if you're interested in doing even further involvement, like let me know. We're actually looking to bring on an intern onto the company to help with the launch and help with our social media. So if you're interested, it's something that you can even do remotely. So so just email me. I'd love to hear from you guys. Yeah. But yeah,
Oh,
we're
thank you,
really
Dr. Sa.
excited. Yeah, we're really excited because we have lots and lots of big things for that company that I can't say, but you just follow us on Instagram at Oral Genome and you'll find out very soon.
Okay.
It's
And for
actually,
everyone, go ahead.
Mhm. It's actually the first direct to consumer dental testing company that's out there. And we've been in research and development for this kit for this whole entire year. So it's about ready to take off to the public.
That's so cool. Everyone in the chat is asking for the email again. I'm sure
Yeah.
we'll put that on our social media. So if you
Yes.
go to the Instagram page, we'll have all that information there for you.
Okay, awesome.
Um,
Any other questions?
yeah, we have a whole lot.
Okay.
Yeah, I have about 15.
Okay, yeah. Ask away.
So does insurance pay for ceramics/zirconia or just the full metal?
It just depends on what insurance plan somebody has. So I have someone in my practice that's dedicated to insurance. So they will go ahead and check. They may, just because if an insurance covers something that's full metal, it doesn't mean that a patient can't get a white crown or all porcelain crown. It just means that it's downgraded, and we would apply some of those funds of the coverage into the porcelain crown. So, yeah, I hope that answers that question. It just depends on what plan they have.
Okay. Do you still perform any restorations with gold?
I do actually. I do get some requests by some older patients to do full gold crowns. I love gold because it's very biocompatible. It's also very malleable. It's very gentle to your teeth. But I can't convince patients to do gold crowns because nobody wants that gold bling unless it's my older crowd.
So if someone's wisdom tooth is growing out, but
Yeah.
it doesn't hurt, do you advise them to just leave it alone, or does it depend on the angulation?
It depends on the angulation. We will actually take some x-rays to find out, because if that wisdom tooth, when it does come out, a lot of patients will already have done some orthodontics, and once it's pushed in, it could unstraighten your teeth and start moving it. Just your mouth is going to start trying to accommodate.
What's the difference between sensitivity to temperature and sensitivity to sweet food?
That's a good question, because I talked about it. You guys were listening and I forgot to talk about it. So sensitivity to hot typically means gives me the suspicion that there is some nerve involvement in there. Sensitivity to sweets means that there is a cavity So a lot of times when you're eating something like caramel or chocolate, it will get stuck in the grooves of your teeth. And if that causes a cavity, you can get a sweet sensitivity from there. Hot sensitivity, like I said, it's close to the nerve. Cold sensitivity, it might have a nerve involvement, but hot, definitely a nerve involvement. Cold typically means it depends on like, it could be a cavity. It could also be gum tissue recession, and also where that sensitivity is located and when the sensitivity occurs. So if the sensitivity occurs when they're brushing their teeth, or that sensitivity occurs um, when they're just drinking or eating a popsicle, that could just mean generalized sensitivity or gum tissue recession. But if it's like a certain tooth, then I'll start looking at the nerve and cavities at that point.
If you're willing to share, and if you had any, what was your experience with debt following dental school?
With what? Sorry.
Financial debt?
Financial debt. Okay. So dental school, I went to private school. I went to Loma Linda University. I was I had some financial aid there. I got a partial scholarship to actually go there. It was actually the dream school I wanted to go to. But I still am paying my debt. I am a graduate of 2014. I still have quite a bit of debt on me that I'm paying right now. It's not, but it shouldn't stop you from doing what you love.
How do you recommend studying for the DAT?
Yeah, so DAT studying, find practice tests. I think that helped me a lot. And also time yourself. I think the big mistake a lot of people will do is like, I want to answer all these questions correctly, and they take a lot of time to think about. But you have to think about it's going to be a high pressure situation, and just time yourself and just do it. Because if you like, don't give yourself any leeway about it, because you have to know like, okay, I didn't do well during this time crunch. How can I improve? I need to study harder, and I need to do it again. So that would be my biggest two things: is find a lot of tests and time yourself quick to do it. Mm-hmm.
What are some important factors you considered when choosing dental programs you applied to?
Yeah, so important factors for me was clinical experience. How many hours were they getting in clinic? What was the requirements? Like, I think at Loma Linda University, I was required to prepare at least 20 crowns, because you need to go to a dental school. And I think all dental schools are great. They're all accredited. But at least for me, the dental school that I chose, Loma Linda, when I came out, I felt confident to practice. Like, I didn't go into a GPR or a residency. I was like ready to just go and start my career in full.
What lasting effects on dentistry do you think coronavirus will have?
Oh gosh, I've actually it's first of all, I would say before COVID, most dental offices were very clean. We have sterilization that kills spores. I've already had filtration before COVID in my office, like the air filtration. We use hospital grade wipes that kill TB. Like, anything that kills TB, like, can kill viruses, bacteria, or anything like that. So, but lasting effects, like, I can't believe, like, before COVID, I was just wearing that regular level 1, 2, or 3 mask. But lasting effects is, I really believe that the N95 mask that we have to wear is going to be there for a long time. The other thing I would say in dentistry is that people are going to be more conscious of their dental health. like during the closure and pandemic, I've noticed that because people were working from home, patients, they may have slacked a little on their oral hygiene. I'm seeing more gum issues in my practice and also more fractured teeth because of the stress and grinding that's happening. I would say that people are now more aware of the dental issues that are happening, and they can smell, this sounds horrible, but they can smell the bad breath in their mask when they're wearing it. And so I'm getting more and more people wanting to come in than ever before because they're realizing their dental issues when they're at home because their mask has been on when they're going out. I don't know if that makes sense. It's like, it's weird because my practice is more busy than it has ever been. And I feel like it's because of COVID. Like people are just more conscious about their health and cleanliness in general of their teeth.
That's all the questions on my end. Krupa, do you have any?
Well, I was curious about how the saliva test works, if you're allowed to talk about that. Like what, I don't know, I'm just interested in like how it would test for these things.
What do you mean? Like,
So you said that it can help predict like likelihood of getting cavities, I think you said. So like
yeah,
how would it do that?
yeah. So we partnered with the CLIA certified lab. They we have a saliva. Our kits, they stabilize your saliva, and once you send that off, we run it through some machines that we have, and it measures all those factors for you. Yeah.
Sounds very interesting. I'm excited to learn about it, and I'm really thankful that we got to be one of the first people that.
Yeah. Yeah.
Well, if there are no other questions, Alexis.
No, we touched on all of them, almost all of them. Some of them were repeats.
Oh, okay, cool.
Alrighty.
Thank you so much for having me.
Awesome, that sounds great.
If you guys ever want to email me, or I'm on Instagram a lot, you can direct message me. Also at Dr. Tina Saw. I'd be happy to answer any further questions. If you guys are ever looking, if you're in the San Diego area, you want to visit my practice or do like some, apply as an assistant, you can definitely reach out to me and we'll see if we have an opening at that time.
Thank you so much, Dr. Saw.
Yeah, I mean, every year we've sent at least one pre-dental student to dental school. So
awesome.
Yeah. So dental students, pre-dental students have my heart because I used to be one of those. And it's a fun and rewarding journey. And I wish you guys all the best of luck in everything.
Thank you so much. And also thank you everyone for tuning in today. And Alexis will be putting the link to the quiz, the attendance quiz, in the chat. And we'll also post it in our Instagram bio and in the group chat. So make sure you guys check that out, and make sure you guys check out Dr. Saw's Instagram too. She has a lot of exciting stuff coming up.
Okay, great. Thanks.
Alrighty. Thank you. Good night.